Supportive connections and healthy practices may help teenagers' mental health. This study indicated that supportive ties with family and friends and healthy practices like physical exercise and improved sleep seemed to protect against the adverse effects of the COVID-19 pandemic on teenagers' mental health. National Institute on Drug Abuse, NIDA, and other National Institutes of Health agencies funded the study, which was published today in the Journal of Adolescent Health. A long-term U.S. study of brain development and child health called the Adolescent Brain Cognitive Development (ABCD) study is used in the research. The study looked at how brain development and child health changed over time. Additionally, the researchers examined determinants of reported stress, anxiety, and depressive symptoms and discovered that females were more likely to suffer psychological distress than boys during the epidemic. More screen time, weaker family ties, and seeing prejudice in response to the pandemic were all characteristics that predicted the distress of youths. In this study, researchers looked at data from a long-term group of more than 3,000 people who took part in the ABCD study between the ages of 11 and 14. They also looked at their families. A pre-pandemic assessment was done by February 2020 for these young adolescents and their parents. The assessment looked at baseline parent-caregiver reports of externalizing problems, such as breaking rules, and sleep disturbances, such as sleep duration, as well as youth reports of internalizing problems. There were 3 online COVID-19 surveys administered between May 2020 and August 2020, each including more than 200 questions covering a variety of psychological and lifestyle topics. Study participants were asked about their experiences with depression, anxiety, and other mental health issues. In order to produce an overall rating of factors according to their relevance for predicting child mental health outcomes, they used an algorithm to analyze the data. Factors such as age, gender, coping strategies, such as eating at set times, physical activity, social connections, and financial means were all included in the analysis. Parents and kids talking about what they're going to do for the next day, taking part in family activities together, and having a good night's sleep were some of the best predictors of a high positive mood and a low stress level and anxiety. People who spent more time on social media and playing video games, as well as people who saw racism or discrimination because of the coronavirus, were more likely to have negative feelings. Those who had mental health or sleep issues at the time of the pandemic were also shown to be more susceptible to the negative effects of the COVID-19 pandemic. The authors also remarked that this research only included 3,000 kids from the pre-pandemic ABCD evaluations and COVID-19 questionnaires, compared to the complete ABCD study sample of 11,800 persons at study admission. If you compare this subsample to the whole ABCD study, you'll find that this group of children is less likely to be Hispanic, Latino, less likely to be Black, and more likely to be Asian. Since this research relies on a sample that is not typical of American citizens, it cannot be generalized. An key learning opportunity during the epidemic was used by the ABCD research team by efficiently pivoting within such a big project and collecting extra COVID data, according to lead author Orsolya Kiss, PhD, a postdoctoral scholar at SRI International. It was also possible to get results based on actual facts rather than predictions or theories. While the team provided guidance on which data should be included from before and throughout the epidemic, the model identified which data was most significant.